My prediction for today is that new healthcare challenges will emerge as we focus on conquering COVID-19. So there are a couple ways of looking at this, and one being from the healthcare industry perspective, which obviously impacts me and my industry, which I'll focus on, but also as a whole, how it will impact others as well within all industries. So the outlook on the healthcare industry is that a lot of patients have had a lack of necessary care over the last few months, ever since the pandemic started, and this has led to deteriorating patient health. Routine checkups have been foregone. We have not been able to properly vaccinate. I'm not talking about the COVID-19 vaccine, but just regular normal vaccinations, because people are not going to their physicians to get those vaccinations. We're seeing a large drop off in a lot of very important critical health screenings. And for example, when comparing 2019 to 2020, you look at the rates for a lot of very critical health screenings, cancer screenings, colonoscopies are down 30% year over year. Bone density screenings down 25%, and this obviously is expected because at the height of the pandemic, a lot of people were not going to see their physician. But it also indicates that care was not made up over the course of the year once people were more open to coming out to see their physician again. Mm-hmm. So this is going to lead to a much more sicker population of patients who now have deferred this care. So about 1/3 of all patients have delayed care in some way, and about 50% of high-risk patients have deferred care. So this has created a lot of impacts. Another one being around the behavioral health impacts, psychiatrists, et cetera. So there's higher rates of anxiety and depression that we're seeing. This is leading to bad habits. Westmed personally, we've seen a year-over-year increase of 15% increase in utilization for behavioral health. And the current run rate, when we look at the last 6 months, the trend, is about a 25% increase. So we're running very high. So from the financial perspective, that may be impacting every organization, not just healthcare, would be the impact on your health plans that you have. Mm-hmm. So you now have to care for a sicker population. This is going to drive the overall care up. You're going to have patients that are now, you're catching up on deferred care. You're sicker because you delayed care. So you saw, if you were self-funded like we were, we're an organization that's self-funded, and we actually, did get a lot of benefit, not in a good way, but there was decreased utilization of our health plan in early 2020 when people were not going to see their physician. Obviously, the costs were in line with that. The costs were down, and we benefited from a plan standpoint. Now we're seeing an increase that is far beyond what I've seen before, and so we've had a ton of high claims that have come through, and it's getting harder to manage this. So this is going to lead to increased stop loss premiums that we're going to see when we come up for our renewal, and it makes you wonder what you can do to focus on how to manage your patient population better, so you're keeping those costs down with part of as you try to manage your risk and the claims that come through. So we're focusing on wellness initiatives for every member, trying to push it out there so that they're pushed to go see their physician. They have incentives to get their annual physicals and screenings, et cetera. And then just doing other things to promote mental health awareness. Not just seeing a psychiatrist, but also the organization itself pushing out programs to offer to our employees that if you're doing normal wellness, if you just need to talk to someone, if we have our own psychiatrists come on and they'll talk to a group session. So we offer yoga and things like that. So thinking outside the box, trying to figure out how we can manage certain tensions within certain groups.